to the End Overdose event here at Pikes Peak Metropolitan Community Church. My name is Pastor Alicia Erickson. I'm the pastor here at Pikes Peak Metropolitan Community Church here in Colorado Springs. Thanks so much for Embark Peer Coach Academy, Rico, and all the groups that are here to make this such a big day.
Hi, my name is Brian. I just wanted to come here today to support this event because overdose is a big part of my life. I was a heroin addict for over 25 years. I've come a long way in the 5 years that I have been sober, and now I have the chance to try to help people that were in my situation. And I myself have overdosed over 10 times, and I've been lucky enough to be saved by Narcan. So I can't even count the amount of people that I've lost to addiction because I was doing it for so long. I felt like there was no way out. And I just want to let people know that there is a way out. You know, you don't have to die that way. You don't have to go out like that.
Hello, everyone. My name is PJ Higgins. I'm the Opioid Prevention Project Manager for the Community Health Partnerships. Today, we're focused on overdose awareness. So wonderful individuals like Brian and many of our other wonderful partner organizations like Aspen Point, who are really focused on doing Narcan and naloxone training, help to save lives in this community. And that is what we're focused on today. And
this is an important story. And the reason it's so important is not because it's a different story. It's because it's so common. My story is most likely very similar to everyone that walks through this road with a loved one, although all too often our outcomes are very different. I just wanted to remind people too that if you're watching this and you know people that have lost, reach out to them, talk to them about their loved one that they've lost, give them an opportunity to talk about the good things, and don't be afraid to ask, how are you today? And that's what I've learned from people that have lost, because every day is a different day and it's all painful and it never goes away. Nobody's gonna, and you mentioning their loved one's name is not gonna bring it up because it's always there.
Good morning. My name is Pete Lee. I'm the state senator from Colorado Springs, and I'm honored to be here today for National Overdose Awareness Day. Thanks to Rob Rushing and the network of people in these recovery organizations who are bringing to light the overdose epidemic that we have in El Paso County, statewide and nationwide, and to make people aware that there are alternatives. And these are public health alternatives, counseling programs, needle exchange programs, awareness programs, and churches that provide counseling and guidance and a hand up to people who are in crisis. So thanks for inviting me to be with you here today. I'm delighted to contribute to the extent that I can to increasing awareness of the overdose epidemic that we have, and that there are alternatives.
All right. Hi, everyone. My name is Sarah, and I'm really, really sad that I can't be there in person today. Given everything that's going on, we'll just hold off. And stolen from the Harm Reduction Coalition, when the time is right, we will hold each other again. So looking forward to meeting you all in person. My name is Sarah Money, and I am the Syringe Access Program Manager here at Access Point Pueblo, which is a program run through Colorado Health Network. Colorado Health Network is a statewide organization. We are dedicated to equitably meeting the evolving needs of people affected by HIV and other health conditions through prevention, care, and advocacy. In 2010, syringe access programs were legalized here in the state of Colorado. Woohoo! So since then, CHN has provided syringe access services at 4 of our offices. I'm going to steal a quote from a webinar that I was on last week. Full credit to Daniel from Denver who shared this quote, but I thought it was really beautiful. So harm reduction is not the opposite of quitting. Harm reduction is means to an end, and it's a safe ride home. So we are here to hold the hands of our participants wherever they're at, whatever they're navigating, and provide that safe ride home, hand in hand with that compassionate support that we always offer. So I'm really grateful to be here today and to share this exciting news with you all. We're really looking forward to the great work that we can bring to El Paso County and how we can help people that might not have anywhere else to go. So thank you very much for your time.
My name's Slade Skaggs. I'm a person in long-term recovery, and what that means to me is I had an illicit street drug or drink of alcohol since July 3rd, 2016. I'm really honored to be here and getting to share with y'all. I'm here to talk about the importance of MARA, that's Medication Assisted Recovery Anonymous. And I guess the best way that I can do that is share a little bit about my story, not so much the mess, but more the message. You know, reducing harm is also reducing stigma. And I know that MARA is a huge part of that for my life and so many other people's lives that I've met, you know, and again, that's not just here locally where I'm at, that's all over the world.
When Rod asked and Terry Smith asked me to speak today about overdose awareness, my story is one that's probably common. If I'm a father, obviously. My daughter is a recovering addict, in recovery, I should say. The paramedics had arrived, and they did find needles in my daughter's purse. They gave her Narcan, and she was conscious. She was alive. If it wasn't for Narcan, I don't think I'd be standing in front of you today.
And have bought into the power of peer recovery coaches and the importance of community in addiction treatment. And moving from abstinence and trying to be a little more attentive to where the patient is and what the patient's personal goals are is a healthy change in medicine and in addiction treatment. I'm humbled and honored most of all by the access to my patients, the fact that I am given the privilege of listening and bearing witness to the personal stories that I hear every day, the struggles and the attempts to make incredibly difficult behavior changes in support of a new life.
I'm Ryan, and I'm an alcoholic. I'm a pastor. What will people think about me? I don't want to do this. I don't want to be here. How do I get here anyway? How did it get this bad? It was never supposed to be like this. The shame. What if people found out? But I said the words. I admitted it, and it was the very beginning of a burden being lifted. My why, my calling, the thing that gets me out of bed in the morning is as clear as ever. To help others find God and beauty in the midst of mess and brokenness. You know, about 3 years into my recovery, I started opening up more about my addiction and recovery. And with the guidance of friends and mentors in my life, I stood before my congregation and spoke honestly about my addiction. And about 2 years ago, my wife Tammy and I started asking the question, what would it be like to start a faith community? A spiritual community that centers on issues of addiction and recovery. 2018, I did 5 other funerals of those who had died of a drug or alcohol overdose, and all but one of them were under the age of 35. We were seeing this very real need in our community. On a very practical level, I was tired of seeing my friends die. Tammy and I started Free Spiritual Community that summer. And what we do at Free is break the silence of addiction while creating space for healing, recovery, and spiritual connection. If you're watching right now and you're battling addiction, you need to know there's a solution. There's a way out of the chaos and despair, but you have to reach out. I'd be happy to talk with you, and I know so many others who would be happy to talk with you, and not just talk with you, but to lock arms and walk with you. But my brothers and sisters, you have to reach out.